ABG analysis. Three parameters must be assessed during interpretation of an arterial blood gas result. Oxygenation. Acid-base status. Degree of compensation. Oxygenation. Evaluate the PaO2. PaO2 less than 80 mm of mercury. Consider age-related alterations. End result is hypoxemia. Evaluate the SaO2. SaO2 less than 93%. Inadequate amount of oxygen is bound to hemoglobin for transport to tissues. End result is hypoxia. Acid-base balance. Evaluate the blood pH, normal, increased or decreased. Evaluate the PaCO2, increased, decreased or normal. Evaluate the HCO3, normal, increased or decreased. Blood pH. If the pH is within normal range, it is important to assess which side of 7.40 it falls. This may indicate that the patient may be acidotic or alkalotic, but compensating. 7.35 to 7.39 is acidosis. 7.41 to 7.45 is alkalosis. PaCO2. Normal PaCO2 35 to 45 mm of mercury. A PaCO2 less than 35 is indicative of respiratory alkalosis. A PaCO2 greater than 45 is indicative of respiratory acidosis. HCO3. Normal HCO3 is 22 to 28 milliequivalents per liter. HCO3 level less than 22 is indicative of metabolic acidosis. HCO3 level greater than 26 is indicative of metabolic alkalosis. Remember Rome. Respiratory opposite. Metabolic equal. If arrows with pH is opposite, it is respiratory. If same, it is metabolic. Assess the pH, PaCO2 and HCO3. If the values are elevated, place the corresponding arrow up. If the values are decreased, place the corresponding arrow down. If the pH and PaCO2 arrows are moving in opposite direction, this signifies a respiratory problem. pH decrease, PaCO2 increase is respiratory acidosis. pH increase, PaCO2 decrease is respiratory alkalosis. If the pH and HCO3 arrows are moving in the same direction, this signifies a metabolic problem. pH decrease, HCO3 decrease is metabolic acidosis. pH increase, HCO3 increase is metabolic alkalosis. Evaluate for compensation. When a patient develops an acid-base imbalance, the body will typically attempt to compensate for the abnormality. If the buffer systems within the body are unable to maintain a normal pH, the lungs and the kidneys will attempt to compensate. If the problem is respiratory in origin, the kidneys will work to correct it. If the problem is metabolic in origin, the lungs will work to correct it. Determine the degree of compensation. Uncompensated. pH is abnormal, and either the PaCO2 or HCO3 is also abnormal. There is no indication that the opposite side has tried to correct for the other. Partially compensated. pH is abnormal, and both the PaCO2 and HCO3 are also abnormal. This indicates that one system has attempted to correct for the other but has not been completely successful. Fully compensated. pH is normal, and both the PaCO2 and HCO3 are abnormal. The normal pH indicates that one system has been able to compensate for the other.